In 2002, Thailand introduced a Universal Coverage Scheme or UC scheme to provide all of its citizens with access to quality health services and financial protection from the high cost of care. Funded through general taxation, the scheme is responsible for providing health insurance to a total of 47 million people who were previously uninsured. Today, 97% of the Thai population benefits from some form of healthcare coverage, and evidence shows improvement in health equity and financial risk protection, especially for those covered under the UC scheme. Sapsin Pooviang, a 65-year-old housewife who lives in the Don Mueang area in Bangkok, is one beneficiary grateful for the comprehensive coverage from the UC scheme. After her husband retired from the Thailand Post without a pension, Ms. Pooviang was transferred to Bhumibol Adulyadej Hospital, a public tertiary care hospital under the Royal Thai Air Force, to treat a prolapsed heart valve.
อ๋อเป็นมานานมากแต่เพิ่งจะมาทราบที่นี่แน่นอนพอมาอยู่ดอนเมืองนี่ก็เข้ารักษาที่นี่ก็เลยทราบว่าเป็นลิ้นรั่วก็ทานยามาหลายปีพอดีคุณหมอก็เลยครั้งสุดท้ายนี่คุณหมอบอกว่าไม่ไหวแล้วคุณป้าต้องผ่าป้าก็ตามใจคุณหมอบอกผ่าก็ผ่าเลยก็ได้สิทธิ์ท้องบัตรทองเนี่ย
She received the surgery 2 years ago and credits her doctor and nurses at the hospital for a quick recovery. She follows up with Dr. Nakorn Phumi, a cardiac surgeon at Bhumibol Hospital, every other month. He too believes the UC scheme plays an important role in the health of his patient.
At that moment, when I start to be a cardiac surgeon, before UC, I have to talk to my boss. We are the government hospital, so we have a limited money for this kind of patient. I try to much. I have run like a when I have to operate on this patient who have not money. I have to go to my boss. I have to go to the NGO. I have to go to some kind of foundation that support us for money for that kind of operation. That takes a lot of energy, including me, who have to try to help the patient. After the UC, I cut that part of my life. I don't have to talk to my boss much. I have not need to go to the foundation to ask for money for the patient. And it's kind of open this channel for the patient who have no money. So I kind of put my energy on the operation and to help the patient no matter how rich they are.
Without the UC scheme benefits, Ms. Pooviang would have had to pay 400,000 baht, or $12,000 for her heart surgery. Using her UC scheme benefits, she only had to pay $200 for the heart surgery and just $3 for each follow-up visit.
มีแต่มันไม่ถึง มันไม่ถึงที่กำหนดไว้ทั้งหมดสมมติว่าถ้า400,000เนี่ยแล้วเงินเราก็ไม่มีถึง400,000เราก็ต้องมาหากู้ยืมเงินทองมาเป็นหนี้เป็นสินอีกแต่นี้โล่งอย่างหนึ่งไม่ได้เป็นหนี้อะไรเลยก็แสนสบาย
Mongkut Wattana General Hospital, a private institution in the northern edge of Bangkok, has participated in the UC scheme for 4 years.
Our hospital have the capability in the tertiary care, but in the private hospital, the customer must pay by themselves. But in Thai people, not every people can support by themselves, especially for the the disease is a sophisticated, it's a high cost. For example, cancer, heart disease, and critical care patients. I think this is a high cost. For the high cost, most people cannot afford by themselves, and universal coverage schemes can support themselves by the government, Thai government.
54-year-old Nok Keo Paksi, a former patient at Bhumipol Adunyadej Hospital, transferred to Mongkut Wattana to receive her 3 times per week hemodialysis treatment closer to home. 4 years ago, Ms. Paksi lost her eyesight due to complications from diabetes and could no longer work as a seamstress. Because she worked in the informal sector, Ms. Paksi doesn't receive Social Security benefits. Her son quit his full-time job and became a motorcycle taxi driver to support her after she separated from her husband. Both she and her son get their health benefits from the UC scheme.
สิทธิ์นี้ดีมากค่ะ ช่วยเหลือเราให้เราดีขึ้นค่ะ เพราะถ้าไม่มีสิทธิ์นี้ เราก็คงอยู่ไม่ได้เพราะเราเป็นโรคนี้ใช่ไหมคะ
Really, we cannot make the revenue we cannot the profit, but we gain any gain from the development of capabilities in the hospital. That's my objective. I think it's very good. We can do some people that can support by themselves, and most people that cannot afford by themselves. So we can. I think it's my customer social responsibility of my hospital. Okay.
Countries of all income levels are pursuing policy reforms to achieve universal health coverage. Health is a human right and a cornerstone of sustainable development and global security. Join us every year on December 12th and help us to continue to build capacity for health for all.